Treatment of blood cancer in Turkey. There are many types of blood diseases that require mandatory treatment. Oncological problems are one of the most common reasons to seek medical help abroad, as there one can expect the best quality and treatment conditions. In this video, we will talk about hematology and bone marrow transplantation in Turkey. We will show one of the best oncology clinics where blood diseases are treated and meet with a hematologist who works in Antalya, Turkey. Discuss treatment methods, Turkish hematology opportunities for foreigners, and success statistics in this field. Subscribe to the channel and ask questions in the comments. Here you will find everything about medicine in Turkey. Blood nourishes almost all organs of our body. It accounts for about 7% of a person's body weight. Hematology is the field of medicine that deals with the diagnosis and treatment of disorders affecting the blood and lymphatic organs. The hematologist is the medical professional who is responsible for diagnosing and treating blood cancer, including leukemia, myeloma, and lymphoma. Hematologists may also be referred to by doctors of other specialties in order to diagnose other diseases more accurately. Hematologists in Turkey successfully utilize new treatment technologies for blood disorders, including expanded bone marrow transplantation capabilities. In our center, we have already performed approximately 1,500 bone marrow transplantations. This is a significant indicator. However, the patient's results are more important than the number of transplantations. Dr. Burak Deveci is a hematologist and bone marrow transplant specialist. He graduated from Gireypaşa University in Istanbul, specialized in Ankara and at the renowned research hospital in Antalya. Has worked at a hospital for about 10 years, considered one of the leading oncology centers in Turkey's medical system. Married, raising 3 children. The rate of survival after bone marrow transplantation in our center is approximately 97%, particularly with haploidentical transplants, where we obtain donor material from relatives with a half match, resulting in a higher success rate. This outcome genuinely fills us with immense enthusiasm, and we are delighted to discuss it whenever feasible because typically, the mortality rate reaches 40% in bone marrow centers, and we are fortunate enough to attain a 97% survival rate. We have almost zero mortality rate within 6 months after bone marrow transplantation. There are new forms of treatments available such as cell therapy. The technology has made significant advancements, particularly in the field of semi-coherent transplantations. Previously, it was not possible to conduct a bone marrow transplant without precise compatibility with the donor. However, advancements in medical technology now allow us to perform a transplant with only a 50% match from an individual. This development enables us to carry out transplants using donors who are related to the patient, such as their parents or children. If a patient does not have a family member whose tissues match, irrespective of whether they are a resident or a foreigner, we can take into account an alternative choice. Our nation collaborates with the Red Crescent organization, and materials from the Turkish stem cell bank can be utilized for various purposes and medical treatments. And in the event that we are unable to find a donor for the patient in Turkey, we also have 2 blood centers of international repute in our country, where we can send a request for assistance. One of them is the International Bone Marrow Bank of Ankara University, which actively seeks and finds suitable donor candidates from any location in the world. The second bone marrow bank is located at the Medical Faculty of Istanbul University, which is commonly referred to as TRIS. Patients are not required to be citizens of Turkey in order to receive these materials. We have the capability to carry out a transplant for any patient who meets the medical criteria. Individuals can approach us from various parts of the globe. We cater to numerous international patients, particularly from Russia and the surrounding nations, for whom we carry out unrelated transplant procedures, and who make regular visits to our facility. For each patient, treatment methods are selected taking into account their effectiveness and safety based on the general state of the patient's health, age, genetic characteristics, lifestyle, and other factors. Turkish oncologists utilize international standards in their work, the identical ones that are utilized in prominent clinics in the United States, Israel, Germany, and Switzerland. Not all nations have equally developed medicine, and not all areas can oncology care be equally successful. In recent years, there have been noticeable changes in global stats on medicine effectiveness in different countries, and surprisingly, Turkey has made it onto the list of top medical tourism destinations. not only due to states' multi-billion-dollar investments in this area, but also to convenient geographical location, good transport accessibility, pleasant climate of country, and very affordable prices for medical services compared to Europe. The quality of training of Turkish doctors is no longer doubted. To choose a hospital that can truly provide the most appropriate medical care, it is important to know as much as possible about the specifics of different clinics, their capabilities, and how the local healthcare system works. Health does not forgive mistakes, therefore the treatment of foreigners in Turkey is handled by a special service company. Her employees know the specifics of this field. They are real doctors with real work experience in hospitals.
After a person submits a treatment request in Turkey, we, the coordinating doctors at Healthy Turkey, select the best clinic and doctors for him based on the diagnosis, preferences, and needs. As practicing doctors in Turkey, we know precisely how to perform it accurately, swiftly, and effectively. Next, we coordinate with the patient the treatment plan and constantly accompany him throughout the trip, as well as stay in touch for any questions even after his return home.
For more info on the work of Turkish oncologists and cancer treatment in Turkey, visit our channel at this link.
Blood cancer seems to be a very large group of diseases: leukemia, hemoblastosis, white blood disease. Can they all be treated with the same degree of effectiveness?
Blood cancer constitutes approximately 10% of the total number of cancer cases that occur in the human population. Can all types of blood cancer be treated? Yes, they can be treated. However, unfortunately, some types of blood cancer cannot be completely cured, so the illness doesn't vanish in these individuals. But we can experience intervals without the illness. This is called remission. After a certain period of time, the disease may reappear. It occurs, but with modern medical knowledge and new skills, especially targeted treatment methods, we can cure almost any type of blood cancer using direct and local approaches that have been developed through advancements in medical science. Now our goal is to utilize additional focused treatment approaches, intelligent medications, and immunotherapy interventions.
How can a person suspect blood cancer, and how do Turkish hospitals usually diagnose these kind of diseases?
In reality, there is no specific condition in which we could definitively say that a person has leukemia or lymphoma without any doubt or ambiguity. What complaints or symptoms can indicate an illness? Generally, patients typically come to us with weakness, fever, recurrent infections, or problems related to bleeding or other medical concerns. Because our immune system cells are manufactured in the bone marrow, as a result, when the bone marrow functions inefficiently, or when cancer cells start to develop, individuals become more susceptible to infections due to a weakened immune response. For example, a patient may come to us with a high temperature that does not subside for a month. Secondly, it can come with bleeding due to the fact that the cells responsible for stopping bleeding and ensuring blood clotting, known as platelets, are produced specifically within the bone marrow. Thus, blood tests may indicate a decreased count or insufficient level of these cells in the body. We may also come across unforeseen bleeding. Once again, this is one of the symptoms that we observe in cases of leukemias. Patients may also experience profound weakness. This could potentially be a consequence of the bone marrow not producing an adequate amount of red blood cells for their body's needs. So, the development of fatigue can be a consequence of anemia. In addition, blood cancer can be indicated by pain, especially in the left part of the abdomen, as some blood disorders can manifest with an enlarged spleen. Thus, complaints pertaining to an enlarged spleen, such as loss of appetite and weight loss, can also serve as an indication of a blood disorder. This is particularly prevalent with lymphomas and chronic lymphocytic disorders. Another indication of the disease can be the enlargement of lymph nodes, such as in the neck, armpits, or groin area. This could possibly be a symptom of leukemia. When patients arrive with such complaints, we must thoroughly examine them for indications of blood cancer to ensure an accurate diagnosis. However, because blood cancer is typically specific, patients generally do not frequently seek our assistance initially. Initially, they typically visit general practitioners or family doctors, where a variety of abnormalities are identified. And only after that, when there is suspicion of a blood disorder, the patient is referred to us for examination.
Could you tell us about the specifics of blood cancer treatment?
As I mentioned earlier, blood cancer is a highly diverse group of diseases. The main objective of our treatment is to restore the bone marrow to a state of healthy functioning, which is the ultimate goal we strive to achieve. There are multiple methods. One of them is standard chemotherapy. This is an old approach, but currently the previously utilized medications are progressively being substituted by new, comparatively intelligent medications that take the place of standard therapy. The standard treatment is chemotherapy, also known as cytotoxic chemotherapy. This treatment causes patients to experience side effects such as hair loss and various other adverse reactions. Secondly, there are several ways of immunotherapy. One of them targets the molecules on the surface of cancer cells. In Turkey, such medications are known as smart drugs. Thirdly, sometimes, especially for elderly patients, it is impossible to apply these methods. This is related to age, physical condition, or problems with the heart, kidneys, liver, or other underlying health issues. Regrettably, in that situation, the sole choice remaining is supportive therapy. The most crucial approach to treat blood diseases is through the procedure of bone marrow transplantation using stem cells as a source. In our procedures, we have the option to transplant either the patient's own cells or cells from a suitable donor. In recent times, various other cellular treatment methods have been developed, one of which is chimeric antigen receptor T-cell therapy, CAR-T. This innovative approach involves genetically modifying our T lymphocytes and killer cells so that they can specifically recognize the tumor and directly target it, leading to more effective treatment outcomes. This treatment is carried out in leading centers. Although it has not yet gained wide popularity, we continue to work on establishing its infrastructure. I believe that in this respect, our goal is to become one of the foremost centers in our country. We possess novel medications that specifically target molecules situated on the surface of cells in a direct manner. These medications are significantly milder in comparison to the previous methods of treatment. So, it is more convenient for us to handle the side effects, and these medications are significantly more efficient than the traditional chemotherapy that has been utilized for numerous years. In Turkish hospitals, ESP as in oncology ones, patients are kept in very comfortable conditions. Now we have been allowed to show one of the wards where patients lie down to recover from cancer. This is our ward. It possesses all the conveniences for patients. As you can see, the patient has the ability to watch television. He possesses a mini refrigerator. Here is a telephone call to summon a nurse and medical equipment that is prepared for any emergency circumstance. There is a kitchen where you can not only make tea or coffee, but also fulfill any of your everyday gastronomic needs and cravings. Located within the ward, there is a designated area where patients and their guests can unwind and interact in a serene and cozy environment without any delay. Private toilet with shower cabin and all necessary toiletries. This level of service greatly contributes to maintaining the emotional balance of patients and therefore plays a crucial role in the overall success of treatment and the approach to recovery. Turkish hospitals understand this well. Turkey is advantageously distinguished from other countries by a comprehensive approach to patient care. In other countries, you often have to pay separately for each manipulation. The company Healthy Turkiye is responsible for organizing visits of medical tourists to Turkey through the all-inclusive system. They work only with verified specialists in both medicine and hospitality and coordinate all their work for each patient. Healthy Turkiye takes all responsibilities upon itself, from consultations and agreements with the clinic and doctor to transfer, accommodation, immigration formalities, and translation of medical documents. Contact for consultation at this phone number or through chat on the company's website, address on screen. There is a lot of information on other directions of health tourism. Don't forget to subscribe to our channel and don't miss new videos about medical tourism and assistance to foreign patients in Turkey.